Hi, Pam Grove here, Doctor of Physical Therapy. So this week we're going to be working on how to develop core stability. So this is for people who have problems with spine issues or chronic back pain. You need to develop strength of your core muscles, so that's your transverse abdominal muscles and your LS or lumbosacroiliac muscles particularly. So I'm going to do it in two parts. Today I'm going to do the ones on the physio ball, and then the next video in 2 days I will do the ones lying on the mat table. Please do not use the physio ball if you have no one to help you off of the physio ball and you're not strong enough. Use the ones on the mat table first and then graduate to the physio ball ones. So, see you in a minute. We're going to work on core stability on a physio ball. So whenever you have any type of spinal issues, you need to increase your core strength. So when I say core, I'm talking about the muscles that come from my LS erector spinae muscles all the way through my transverse abdominal muscles in the front. Okay? So once again, I'm looking at alignment. Am I in alignment? My trunk in alignment? Are my feet flat? I'm looking at my feet position. I'm looking at my pelvis position. So I want to get my pelvis to work. So there's an exercise I want to do that's called a pelvic clock 12, and that's a posterior tilt. So I'm getting my pelvis to shift so that my pelvis is coming up towards my breast line, but my muscles in my low back are elongating, they're stretching. So that's a pelvic clock 12 position. If I go into a 6 position, you see, my back arch, my pelvis drop down. So let's say I say, okay, I want us to do 12, and we hold that for about 20 seconds. And then we say we do 6. But the position that I want you to emphasize is always the 12. So I get the elongation or the stretch of my erector spinae muscles in my low back. Now, suppose I say I want to get my lateral muscles on side to side. I want to do 3 and 9 position. I don't change my feet position. I'm still facing straight on, right? I go do 3. I do 9. I'm going to do that again. So I do 3. I'm going to hold that for 20 to 30 seconds. But I'm doing a little faster. And then I do the 9. Once again, I'm still keeping my alignment of my trunk. My knees are facing forward. Now, suppose I want to do the entire clock. So I do all of the motion completely, all the way around, clockwise. I don't move my feet. And then I do counterclockwise. And it's good to do them both about the same amount of times, at least 5 to start off with. And that's going to help you build core stability.